pharmacology or medicine references. Methylene Blue, detailed drug information. Number 1. General information. Generic name, Methylene Blue, MB. IUPAC name, 3.7 bis dimethylamino phenothiazine 5-ion chloride. Drug class, antidote, diagnostic dye, antimalarial, historical use, urinary antiseptic, older use. Brand names, Prove Blue, USA, IV injection, Uraline Blue, urinary antiseptic, discontinued in many places. Generic methylene blue injection, widely available. Drug forms, injection, IV solution, most common in hospitals. Oral capsules, tablets, less common, investigational. Topical solution, dye for staining tissues during surgery. Definition: methylene blue is a synthetic heterocyclic aromatic chemical compound that serves as both a medicinal agent and a dye. Clinically, it is best known as an antidote for methemoglobinemia, a condition where hemoglobin is unable to carry oxygen effectively. Number 3. Mechanism of action. Methemoglobinemia treatment. Normally, hemoglobin carries oxygen in its ferrous state, Fe. In methemoglobinemia, hemoglobin oxidizes to ferric state, Fe-free, which cannot bind oxygen. Methylene blue, MB, is reduced in the body to leukomethylene blue. Leukomethylene blue acts as an electron donor, reducing methemoglobin back to functional hemoglobin. Other pharmacological effects: inhibits nitric oxide synthase and guanylate cyclase, vasoconstrictive effects in vasoplegia. Acts as a reversible monoamine oxidase, MAO, inhibitor. Risk of serotonin syndrome when combined with serotonergic drugs. Exhibits antimicrobial and antimalarial activity. Historical, limited modern use. Uses: primary use, FDA approved, treatment of acquired or drug-induced methemoglobinemia. Other medical uses: intraoperative tissue staining, sentinel lymph node mapping, fistula detection, urinary tract visualization. Urinary antiseptic, limited, older use. Adjunct in vasoplegic syndrome after cardiac surgery. Investigational: Alzheimer's disease, malaria, septic shock. 5. Indications: acquired or congenital methemoglobinemia from drugs like benzocaine, dapsone, nitrates, sulfonamides. Diagnostic staining during surgical procedures. Off-label vasoplegic shock, cyanide poisoning with other antidotes. Number 6. Contraindications. Absolute contraindications: hypersensitivity to methylene blue, G6PD deficiency, risk of severe hemolysis, concomitant use of serotonergic drugs SSRIs, MAOIs, TCAs, St. John's wort, linezolid, pregnancy, especially second, third trimester, teratogenic, relative contraindications, severe renal impairment, infants 3 months old, risk of hemolysis, methemoglobinemia worsening. Now, number 7, precautions before taking. Medical history, G6PD deficiency, kidney liver impairment, history of serotonin syndrome, pregnancy and lactation, crosses the placenta, fetal toxicity, intestinal atresia, teratogenic effects, excreted in breast milk, avoid unless life-saving. Patient counseling, causes blue or green discoloration of urine, stool, skin, and mucous membranes, harmless but expected, may interfere with pulse oximetry readings, causes false low SpO2 values. 8. How to use. Administered intravenously, IV, in a hospital or clinical setting. Dilute in 50 milliliter% dextrose solution, then infuse slowly over 5 minutes. Oral and topical forms used only in special circumstances, not standard therapy. Number 9. Dosing information. For methemoglobinemia, most common indication, adults and pediatrics, 3 months, 1 to 2 milligrams per kilogram IV, 0.1.2 milliliter kilograms of a 1% solution, infused over 5 minutes. Dose may be repeated after 1 hour if needed. Maximum cumulative dose, 7 milligrams per kilogram. Neonates generally avoided due to increased risk of hemolysis. Number 10. Missed dose and overdose. Missed dose, not applicable, hospital-administered medication. Overdose symptoms: paradoxical methemoglobinemia, worsening condition, severe hemolysis, especially in G6PD deficiency, serotonin syndrome if combined with antidepressants, seizures, arrhythmias, hyperbilirubinemia, management of overdose, supportive care, oxygen therapy, exchange transfusion if needed. Number 11. When to stop or avoid taking. Development of allergic reaction, rash, swelling, breathing difficulty. Signs of hemolysis: dark urine, jaundice, anemia, confusion, fever, tremors, seizures, possible serotonin syndrome, if pregnant or breastfeeding, unless life-threatening indication. Number 12. Side effects: common, mild, nausea, vomiting, abdominal discomfort, dizziness, headache, sweating, metallic taste, Harmless blue-green discoloration of urine, skin, stool, serious. Hemolytic anemia, SB and G6PD deficiency, methemoglobinemia, paradoxical effect, and overdose. Serotonin syndrome, agitation, hyperthermia, rigidity, seizures, cardiac arrhythmias, chest pain, severe hypersensitivity reactions. Number 13. Vital information, always administered under direct medical supervision, may interfere with laboratory tests, urinalysis, SpO2 readings, co-oximetry. Dose-limiting risk of hemolysis in G6PD deficiency. Inform all healthcare providers if you are on antidepressants or serotonergic drugs before methylene blue use. Number 14. Drug interactions. Major interactions, risk of serotonin syndrome, SSRIs, fluoxetine, sertraline, citalopram, paroxetine, SNRIs, venlafaxine, duloxetine, MAIs, phenelzine, selegiline, tranylcypromine, TCAs, amitriptyline, imipramine, atypical antidepressants, bupropion, trazodone, mirtazapine, other serotonergic drugs, linezolid, tramadol, St. John's wort, MDMA, ecstasy. Moderate interactions. Sympathomimetics, pseudoephedrine, epinephrine, increased hypertension risk, drugs causing oxidative stress, dapsone, sulfonamides, nitrates, worsen hemolysis, methemoglobinemia. Thank you. Have a nice day.